Hello everyone, this is Dr. Kother coming to you from Muscat, Oman. Today we will discuss some of the do's and don'ts of controlling meltdowns in children with autism. While making this video specifically with children with autism in mind, these techniques can be used on all children. One of the major questions I get in my practice is what kind of behavior techniques can I use for my child to control their outbursts and meltdowns. In many cases, the attention that children with autism receive for negative or aggressive behavior makes them repeat the negative behavior. It doesn't matter whether the attention is positive or negative, the child just wants the attention. Parents need to understand how to react to this challenging behavior so that it can be controlled. Intervention is important so that the behavior does not escalate. While many of you may have taken up temporary measures to alleviate these problem behaviors, but unless you have long-term behavior control strategies in place, your child might end up hurting others or in many cases hurting themselves. There must be some measures in place in order to decrease negative behavior and protect everyone's well-being and safety. You don't always have to do something. Many times there are some actions that you should avoid doing. First, I will go over the list of do's. The first one I have is gestures and visuals. Gestures and visuals tell someone what you want them to do without using words. Touch them on the shoulder or wave to them to get their attention. Then use hand gestures to tell them to sit or stand up. It is authoritative without paying attention to the negative behavior. The next one is prevent aggression without engaging. The best approach to accomplish this is to keep the child away from others. Do this without speaking, engaging, and avoid eye contact. Additionally, use a cushion, a chair, or anything else to obstruct their view of the child or the person they may be targeting. Keep a watchful eye on them to ensure safety. The next one is to attend to the victim. If a child is assaulting, bullying, or taunting another child, keep an eye on the child who is being targeted. Ask them if they are all right, fuss over them, and give attention to that child. Ignore the aggressive child and speak with the victim about the expected response in such situations. Ignoring someone goes a long way. The next one is ensuring safety. Do not jeopardize safety in order to avoid providing attention to the aggressive child. This may go without saying, but it is crucial to know that aggressive behavior in children with autism can escalate, and you'll need to intervene to protect the child from running into the street or a busy parking lot or injuring another child. These are the instances when you must interfere, but do it with giving little attention as possible to the aggressive child. The last point is to monitor your own emotions. It is difficult not to feel enraged with some of your child's behavior, and maintaining a neutral expression is difficult but doable. An expressive face just encourages attention-seeking behavior. When a child grabs someone's hair out of nowhere, smacks, pinches, or bites you or someone else, keep your cool and do not yell or scream. Do not react to the situation. If you feel overwhelmed, request that your spouse, adult family member, or a family friend take control of the situation while you go gather yourself and cool down. Okay, now we're going to talk about the don'ts. Firstly, don't talk or yell when a child with autism engages in such aggressive behavior or meltdowns. The behavior is the result of them being distressed about something. It is frequently not purposeful, but reactionary, and is not a good moment to try to reason or explain to them about their behavior. Speaking to them is likely to intensify the undesired behavior. Next, avoid touching. Touching or trying to hug a distraught child will only intensify the situation, and they may try to hit, kick, or bite you. If it's only a pretense for the child to gain attention, physical contact will enforce the undesirable behavior. Physical intervention should be used only to assure safety when needed, but it should be as brief as possible with no verbalization or eye contact. Don't discuss the child's behavior. Even if you're not talking to your child, don't mention the negative behavior he's displaying in front of them, since it will encourage more negative behavior. This is merely paying attention to the behavior, since you are discussing it in front of them. You'd be surprised what a child can hear when they're having a meltdown. Instead, talk to your other children about what they're doing well and what you expect of them. You'll deliver a good message while diverting attention away from your child who's displaying undesirable behavior or a meltdown. If you don't have any other children, engage in other activities instead of attending or responding to the negative behavior. Next, don't be hesitant to teach acceptable ways to seek attention. Behavior is maintained by a counter-reinforcement behavior, and the replacement skill in this case would be something that attracts attention correctly. Reinforcement should be used in addition to teaching the skill. For example, tapping your arm or utilizing a communication device. If your child receives more consistent attention for the negative behavior than the replacement skill, the negative behavior will persist. Finally, don't forget to keep a diary to monitor your child's inappropriate behavior. It is critical to keep a journal and track your child's negative behavior. You should describe what happened prior to the behavior, as well as the repercussions of the action or activity that was taking place, such as your child having a meltdown in the park because he didn't want to wait his turn in the slide. And what happened following the behavior? For example, what tactics did you use to soothe your child? Did you manage to keep calm, or did you lose control? This is a useful tool for assisting your behavior or occupational therapist in understanding the child's behavior and which strategies work best for them. I hope this has given you some thoughts and ideas on how to deal with undesirable behavior in children with autism. Despite the fact that the emphasis is on attention-seeking behaviors, these techniques may be used for other types of negative behaviors in children. Not only those children who have autism, but for all children. It is critical to avoid rewarding undesirable behavior by reacting to it verbally or physically. It is also important to react to positive and proper behavior so that you see more positive behavior as a result of reacting, complimenting, and rewarding the desired behavior.